your student nurse today. The doctor has ordered me to insert an IV in you, if that's okay with you. So basically what that means is I'm going to put a needle into your arm, and there's going to be a little plastic tube over it. The only thing that will be left is the plastic part so that we can give you fluids and medicine through that. Do you have any questions about it? All right. All right, I'm gonna grab some gloves. Okay. And can you just confirm your name and date of birth for me? Okay. And do you have any allergies? All right, so there it says milk and cats right here. You are allergic to that and these hydrocodone and Benadryl. So I'll get the allergy band changed. Can I have registration, please? I need to do Brittany. Thank you. Alright. Okay. I'll raise this bed up. Baby. Alright. Okay. And before we start, do you have any history of cardiovascular accidents, like a heart attack, for example? No? Okay. Are you on dialysis or have been on dialysis? No? Okay. And do you have any history of breast cancer or have breast cancer? No? Okay, perfect. The skin integrity looks good. It's intact. There's no tattoos. If there was, I would document those as well. So I'm going to change the gloves. Perfect. So the first thing I'm going to do is just put this strap strap on you. It's called a tourniquet, and it's going to be a little bit snug. It's just so I can see your vein better. It shouldn't hurt or anything, and I'm not going to leave it on longer than a minute. There we go. Alright, you doing okay? Alright. So I found the vein, so now I'm just going to clean your arm. And we're going to clean for 30 seconds, horizontal, circular, and vertical. Alright, so I need to let that dry, so I'm going to open both the pads while that dries. We're going to prime this.
Can I get registration for an armband, please?
There we go. We're going to leave that in the little bag.
That's both of them say 50. I'm 50, that's right. Yes, you're right. That is my bad.
It's okay.
Thank you.
You're welcome.
Okay. Alright, I have these nice and close, so I'm going to go ahead and change my gloves.
What that is we're going to put the needle here down. You have a little stick. The needle will say that you take the needle out. There'll be a tube so we can put medicine in. Sound good for you? Great.
All right. Okay, are you ready? All right. I'm just gonna tie this tourniquet back on. Again, it won't be on for longer than a minute. Okay. Okay, I got blood return, so I'm going to advance that. And pop that tourniquet. Now I'm going to hold pressure. Okay, while continuing to hold pressure, I'm going to attach the extension tip. We're going to draw back to make sure we're in a vein. Okay, you see blood. Not in the syringe though, so I'm going to flush 5 milliliters. Alright. We're going to get rid of this, throw that away.
I'm going to start by assessing it.
Okay, you doing okay?
Put this tourniquet on you.
We're all done with that. I'm just going to get you cleaned up and put your tape on.
I'm not going to leave it on for more than 1 minute. Before I do this, I will make sure, I would ask, do you have a history of breast cancer or lymph node removal? Do you have a history of stroke? And are you currently on any kind of dialysis or used dialysis before? I would also assess the skin integrity and see if you had any tattoos that you could be aware of.
Can I have a tech, please? I just need a new Tegaderm. Thank you. All right. Okay. And we're going to throw our needle into the sharps container. We're going to throw this stuff away. And get the tape. Alright, I'm just going to secure this so it's not falling around everywhere. Alright. You doing alright? You feeling good? Okay, we're all done. I would lower the bed back down, make sure they have their call light, make sure they didn't need anything before I left. And I'm going to label the IV with the date, time, the gauge of needle. And then my initials as well. Alright, and then I'm going to wash my hands and leave the room, and I'm going to come back whenever the doctor orders me to take out the IV. So,
Start.
okay, I'm going to walk right in. Hi, my name is Tatum. I'll be your student nurse today. The doctor has ordered me to take out your IV, if that's alright with you. Sounds good. Alright. Just going to wash my hands really quick.
no surgery. Okay. Great. Next, you'll hit fetch.
All right. And can you confirm your name and date of birth for me? Okay, and do you have any allergies? No? All right. I'm gonna raise the bed up. Alright. I'm just gonna use an alcohol pad to loosen this tape so it doesn't hurt as bad coming off.
Feel a little sting. Alright. You ready? Great. Make sure the bevel is facing up.
Okay. Now we're gonna take this tegaderm off. Alright. Now we're ready to take this IV out. I got some gauze ready for you. Alright, and we're going to take it out on the count of 3. 1, 2, 3. And hold pressure there. This would go into the sharps or biohazard container. We're going to hold pressure until the bleeding stops. Alright. We're going to throw this stuff away. Okay, are you feeling okay? Do you need anything? Right, and this catheter is intact. Alright, if the patient didn't need anything, I'm going to lower the bed back down and give them their call light. Make sure the bed rails are up for them. And wash my hands again.
Thank you.
Alright, and then I'm gonna leave the room and throw all this stuff away. I'll show you my needle. You should say first. I accidentally put my needle on the shots container.
The whole thing?
Uh-huh. Are you sure? I think you can see it on the video, and you can see the blood in my catheter too. So, okay.
I heard you. You're good.
Alright.